About history, as Nick was saying, open dialogue is not a strategy or a technique. And the practice came first. And I was talking with Markus Utela, our chief psychologist, last Friday. And he was telling about history, which I have heard before also, but he was saying that it was kind of many coincidences happening in the same time. The law was changing in Finland. There was, until the end of 70s, there was A hospitals and B hospitals. A for acute patients and B for the chronic patients. So they stopped this division, is it the right word? Yes. And so there came this question that should Kero-Budas be integrated into the bigger district in northern Finland. So in that time there came Markus Utela, Birgitta Alakare, Jaakko Seikkula, psychologist, and lots of new workers. They came to work in this area, and they decided that we need to do something in this situation. And they heard a work that Yrjö Alanen, a professor from South Finland, Turku, he and his team had been working with this, it was called Schizophrenia Project. And they were trying to find new ways to work with families. And they found out that the outcomes were better when the families were involved. And also they found out that that it is really important to adapt your work into every situation that comes across in the treatment processes. But in Kero-Budas, in the same time, they started to study family therapy. And they started to have these so-called treatment meetings. And this was a very big change for the practice they had until that. Because it used to be so that nurses and doctor, they had a discussion together in the staff room about a patient. And they were talking that, okay, we are going to treat him like this for the next 2 months. Medication is going to be like this, occupation therapy like this, and so on. And so they went to the patient and told him that this is what we are going to do. So they started to have these treatment meetings all together. So they were discussing about what should we do, and how should we do it, and why, and with whom, and so on. And this was really, I've been told that many nurses were saying, we can't do this. We have to talk about it first with ourselves. We can't go there and talk about the things with patient and family members. Because this was also a new thing, to invite family members into these treatment meetings. But they realized really soon that this is working and this is something we need to develop. And so in the end of 80s, they also started to gather material for the researches, and also they started to run the training for the whole staff. I think we have had 9 training processes until from that, and it's free for the